most of the people are actually, they don't know the difference between psychologist and psychiatrist. So I think if you
Okay.
can clarify the difference between the two in terms of training and treatment.
A psychologist is generally a doctorate level provider who has a PhD or a PsyD. A psychiatrist is an MD, a physician who can prescribe medication. A psychologist is generally someone who does psychotherapy, and a psychiatrist is generally someone who does psychiatric medications and who can also do psychotherapy.
And I think this is actually a question that, I want to know from you, that you have been into this practice since 20 years, right? And that's a pretty long time. So how do you cope up? Because you're a mother and, as you said, your kids take a lot of time, then your horse also takes time. So how is it that you connect emotionally with your patients? Because I think this is a very, as you grow in your life, you become more deeply connected to people. So how do you manage and how does it? Like, please let us know about it.
Empathy. I think, and the more life experience I get, the better I can connect with people. So the more things I go through in my life, the easier it is for me to relate to what someone else may have gone through. I think empathy is so important when you're doing mental health. If someone has had a difficult time, putting myself in their shoes and imagining what that may have been like, I think it's so important to try to connect and not over connect to the point where you kind of lose yourself and lose your ability to think objectively. But I think that's really what everybody wants is for their doctor to really try to relate. I do think that's the benefit of seeing a female provider who's a mother, who's had more experience, is that I have been through quite a bit in my life and can relate to a lot of people.
I think, Dr. Cara, most of the time people are very much hesitant. And they don't say out loud that, yes, they are depressed or they are going through something. So they hide it.
Yeah.
So what do you think? Because you have been connecting with a lot of people. Why are they so afraid to say out loud? I mean, what is the thing behind it?
Yeah, I think it's hard for people to talk about their mental health struggles sometimes because they feel shame or inadequacy. Like postpartum depression, for example, can be hard to talk about because, like, when you become a mother, for example, we kind of feel that we're supposed to be enjoying the baby and enjoying motherhood, and yet we feel sometimes, not all women, but sometimes we feel a lack of joy and a lack of pleasure and total exhaustion. And then it's shameful to not be enjoying the experience and we feel inadequate. So it's really hard to open up about that. So I think that's probably why. Mental health is this really difficult area within medicine because, if you break your leg and you go to the doctor and you're like, I broke my leg, it's not that embarrassing. But if your brain isn't working, it can be embarrassing. And so I wish that it wasn't that way. I wish that we didn't have that experience. And that's why it's more complex, I think, compared to other sort of organ systems.
Till then, do not forget to like, share, and subscribe to our channel. And thank you so much for being here. See you next time, everybody.